Now, driven by a more infectious new COVID-19 variant, the second wave of South Africa's coronavirus pandemic has seen considerably more infections than the first wave. Now, this means that health workers have had to deal with more hospitalizations and deaths and a lot more pressure. Begisisa visited George Mkhari Academic Hospital north of Tshwane to document the second wave realities experienced by doctors and nurses. To expand on this, I am now joined by James Otway, Begisisa health journalist, to give us a sense of what exactly he observed there. James, a very good evening to you. Thank you for your time. You spent an entire day inside George Mkhari Academic Hospital. What did you make as, you know, the staff and the health workers are grappling with these high numbers and the increase of deaths and cases in comparison to what we saw perhaps at the beginning of March last year?
Yeah, thanks for having me, Umpo. Yeah, I suppose I could just say that, you know, spending the day at the hospital, it left me with a lot of mixed feelings. I can't stress enough that, you know, this is the front line. This is like a war that's being fought. And the doctors and nurses that are going in there every day are on the front line of that war. And yeah, I mean, I saw a lot of troubling things, obviously. You know, it's never pleasant to see people in pain and suffering. But I was also left, you know, feeling very inspired by, you know, and impressed by the sacrifice that these health workers and in fact all the employees that I saw there making such a sacrifice by going in every day, and that was quite inspirational to see that.
Inspired and impressed by the health workers, we know that these are the very same health workers that nursing union DENOSA, for instance, has said that they are battling with the psychological elements of dealing with the second wave and, you know, really just calling for some support and intervention to support the health workers during this time.
Yes, so that was probably the you know, the most resounding message that I received while I was there, and it was, I mean, you could see it in the wards, and you could see it on the tired faces of the nurses and the doctors. They don't have enough staff, and this was repeated to me over and over again. You know, like nurses would tell me, please get the message out. We need more staff. We need more nurses. You know, they have to do long shifts, especially in the COVID wards, where patients are kept in isolated wards. So you'll have one nurse that will have to look after, you know, quite a large number of patients in an isolated ward, and they have to, you know, be dressed in full PPE. And they can't leave for at least 6 hours, sometimes longer. You know, and they'll come in there at, say, 7 in the morning, and have to spend 6 hours without eating, without being able to go to the toilet or take a break, and often longer, because there just aren't enough staff to, you know, reinforce them and to be able to relieve them when they need a break. So yeah, this was repeated to me in different sections of the hospital, as well as in the ICU unit, where, you know, some of the nurses there told me it's so tiring. It just takes it out of you, because they just don't have enough qualified professionals to help relieve the pressure.
You say you saw some disturbing things when you were there. What are some of those disturbances that you witnessed there?
Well, you know, obviously seeing someone who's, you know, very ill, who's battling to breathe. You know, I would see this in various different wards. You know, you know, I have to say that the COVID wards, where the patients who have been, you know, into these isolated wards, they've mostly been put on oxygen. Those wards all looked very organized, and they were very sort of calm, and they were actually renovated last year. So the staff were telling me that for the first wave, they didn't even have many wards. All the patients would be taken care of in the accident and emergency section. But, you know, they made a lot of renovations, And now they've got several dedicated wards just for the COVID patients. So that was actually good to see. It looked very organized, except obviously the difficulty in the staff shortages. The biggest problem for me seemed to be at the current accident and emergency section, the casualty section. And this is where all the patients who arrive, it's the first place that they arrive, and it's the first area that they go into. Now, that ward is very small, very cramped. It's poorly ventilated, very hot inside there. And you'll find patients in stretchers and on gurneys and just sitting next to each other, crammed up near each other. Some people will be sick with COVID, or at least with suspected COVID, and others will be there for maybe a broken arm, or they were in a car accident. It seems like a very risky place to be if you're not infected, because you'll definitely be exposed to the virus in that area. So I think some attention would need to be given to that particular area. But yeah, just seeing people struggling to breathe, seeing the fear, a lot of people are very afraid of what's going to happen to them when they go into hospital, and and the thoughts, will they come out? So to see this fear, but also to see the the bravery on the faces of the medical staff. As I said earlier, it's they mentioned to me as well that there are a lot of psychological challenges. A lot of nurses and doctors have died, staff members, cleaners even. I spoke to a cleaner and photographed a cleaner who has been working at the hospital for 5 years, and she herself became infected and became a patient in the hospital, and she didn't receive any special treatment. She waited in the casualty section, she told me, for 2 days before she was able to get a proper bed. But luckily she made a full recovery, and she's back at work now. And she says that, she can relate to the patients because she knows what they're going through. And, that's why she comes in, and she's extremely passionate about her job. So that was beautiful to see.
Mm-hmm. With, some inspiring stories that you came across, we know that, of course, health workers are the frontline workers who will be first in line to get a COVID-19 vaccine when it arrives. What were the general sentiments that you perhaps came across when it came to health workers and accessing the COVID-19 vaccine? Were they eager to take it, or did they give you the impression that the health department perhaps needed to do more research and convince them even more? What did you make of that sort of reaction and conversation around the vaccine?
Yeah, so that's a very interesting question. I think a lot of people would just expect health workers to just be, running to the front of the line, say, give me the vaccine. But several of the health workers there that I spoke to expressed, a bit of cynicism, and expressed reservations about taking the vaccine. And like, for example, one of the nurses told me that she's 50-50. She's not sure whether she really wants to take the vaccine. The first reason being, is it even going to work against this new strain of virus that we have here? There was another nurse told me, like, she's heard a lot of bad things about the vaccine, and she was alluding to some of these theories that, for example, Africa is used as a testing ground for all sorts of, unsafe medication. And she expressed sort of concerns about, possible side effects and things like that. So I definitely think that it would be a good idea for the department to look into, educating, demystifying the vaccine, actually, taking away any kind of mystery or, like the shadows, and just to shine a light on it, make sure the health workers understand exactly what it does, and what the benefits are and what the side effects are, so that they can be in a better place to make an educated decision about the vaccine.
And, as a photographer, of course, images and people's faces and, the reaction was, of course, something really important to capture during this time. You know, you speak about packed wards, and we learn about the infectious bodies, and we see the numbers increasing by the day. And, of course, the desperation of those wanting help and not sure if they'll get it on time. Talk us through then, you know, some of the images that will stay fresh in your mind after that visit.
Well, yeah. So one of the things, you know, it's I've been doing this job for a long time, and it's you know, often the pictures that I take do stay with me. You can't just you know, you don't come out untouched by the people you meet and the things you see. And so for me, it was really, you know, it was very scary actually to see the fear in people's faces. There was one man who was really struggling to breathe. He was on oxygen, but even the oxygen wasn't helping. And I remember seeing a doctor explaining to him that, you know, it's time now, we're going to have to intubate you and put you on a ventilator. And this is obviously quite a serious procedure. And some people, you know, they don't come out of it. But I then saw him being wheeled into the ICU, and then I did watch the procedure. And it's just struck me as, you know, this is what the realities of COVID are. You know, luckily for him, you know, the doctors there seemed extremely professional and dedicated and caring. And the ICU ward itself was, you know, converted from a burns unit and was in very good condition. So I'm not sure what happened to him. I really pray that he made it and that he's recovering. But yeah, I mean, it's very important that the public see what's happening inside our hospitals. You know, they have a right to know what's happening inside the hospitals, because with this pandemic, you know, it could be any of us that end up there, and we need to see what's happening. We need to not be afraid of the unknown. So it's important that, you know, we're able to report on these stories and cover what's happening inside.
Thank you so much for sharing your story and for your time. James Otway, Begisisa health journalist, giving us a sense and the reality inside the George Mkhari Hospital after he spent a day there.